Hi, welcome again. I've been doing this YouTube series in relation to chiropractic and deafness, and today I want to talk a little bit about communication. So, for someone that has hearing impairment or that's deaf, you want to communicate with them in certain ways, and you need to be more conscientious of how you communicate with them as opposed to someone that, a typical hearing. One of the big things with chiropractic is that we do adjustments, and a lot of times we have people go face down on the table. And as we're adjusting, so I'm directing this towards all the chiropractors here. As we're adjusting, we just say, tell me if this hurts, tell me if there's too much pressure, that sort of thing. With someone that has a hearing problem, hearing difficulty, they're not going to be able to hear you, or they're going to struggle to understand you while they're laying face down because they can't see your lips, or if you're using sign language, or if there's an interpreter in the room, obviously they're not going to be able to see that when they're laying face down. So it's very important that you communicate everything precisely before they lay down on the table. So you need to be very clear, both in the way you speak and also in your instructions before they get down on the table. So you need to work out a signal, like if they feel pain, they should put their hand up, raise their hand, make a sound, something of that sort. If it's uncomfortable, if there's pressure, or if there's any kind of a problem. One thing also to be very conscientious of is you need to face the person. Don't look away and talk this way. Don't mumble your words. Speak clearly. Speak concisely, but don't yell. This is something that hearing people make the mistake of all the time. Deaf people don't need you to yell. They don't want you to yell. You should be speaking clearly. You should be speaking, a little louder if you're soft-spoken. But don't yell at a person. That just comes across as kind of rude. And if you're yelling, a lot of times you tend to talk faster, which makes it more difficult to understand, or you don't speak as clearly. So you want to make sure that you're not yelling, you're just speaking clearly, enunciating your words properly, looking at the person directly so they can look at your lips and read your lips. If you have a mustache or facial hair around your lips for the men, you want to be very conscientious of that. That may obscure the person's ability to read your lips. And for someone that is profoundly deaf, you may have to get an interpreter for them. If they don't have an interpreter, most of the time state law does require that you provide a sign language interpreter for them. And if you call the state, the Division of Deaf and Hard of Hearing Services, a lot of times they can provide you with an interpreter for your patient if they don't have one. But these are just some things that you want to be mindful of. People that can't hear very well, may not speak very clearly, particularly if they're deaf, because they can't hear you very well, and they can't hear their own voice very well. And especially for someone that has trouble hearing the softer sounds, think about it. Pa, ka, ash, ta, sh. All of these things can be very difficult to hear and pick up on. So for someone that can't hear very well, particularly in the level of softer sounds or higher pitched sounds, they're not necessarily going to pronounce those words correctly, so they're not going to speak clearly just because they can't hear those sounds. So you want to be mindful of enunciating your words properly, speaking clearly, looking at them directly, and then also being patient with them when they're talking. If you really can't understand them, you could always have them write it down or type it. Almost everybody has a phone nowadays, so they could type it. But give them a chance to talk and express their feelings and say what they need to say. Just be patient. And this is also called bedside manner for all of us fellow docs. So these are just some things to keep in mind if you are going to work with the hard of hearing or the deaf population in chiropractic, or if you have a patient that has difficulty hearing. And nowadays it's going to be almost anyone, because you definitely have the older population. A lot of them can't hear as well, and then people are losing their hearing for lots of different reasons. There can be exposure to loud noise, or conditions such as Meniere's disease, and these people do need our help. They want our help, but they may struggle with the hearing, and they may be a little bit embarrassed, especially if they heard well in the past, and now they can't hear well. It may be a little embarrassing for them that they can't hear. So just remember to be patient, talk slowly, talk clearly, make sure you give all instructions while you're looking directly at the patient and maintaining eye contact. Don't try and give instructions when they're on the table, especially not if they're face down. And that would be just a good way to establish a good communication or rapport with your patient. Alright, so I hope all of this helps, and I'm glad to hear. I'll do some more signs in another video so that you can experience some things. For those of you who didn't see my sign video, there's some signs such as like doctor, you make the D. This is doctor. This can be for spine, and then you can finger spell chiropractor. So CHIROPRA, that would be ACT. So you have a thumb in between the first two fingers there. O and R is chiropractic. Alright, and so thank you for your time, and I will talk to you very soon.